So for persons with asthma, the importance of doing a warm-up is stressed because you're going to humidify the air, you're going to increase blood flow circulation, and they probably do need longer warm-ups than an average person. So be sure that they do a warm-up, and that they do a warm-up that is slightly longer, and that get that better humidification of the air, and air breathing through the nose versus through the mouth. So that may reduce the severity of the exercise-induced asthma, and it can make the refractory periods a little bit lower. Typical medications, and if anybody, in class when we get to talk about that, often our students that have had asthma in the past or they have it now, probably the most common one, your beta agonist, so your inhaler, that's your rescue inhaler. So albuterol, and so 1 to 2 puffs on the inhaler before exercise, and then they are normal. Athletes can compete using an inhaler. They have to go through a big certification process in order to ensure that they actually do have exercise-induced asthma. So, but those are your typical rescue inhalers. So again, beta agonists, they do mimic caffeine. Mast cell stabilizers, inflammatory, to reduce the inflammation. Glucocorticoids, prednisone, once again reduces inflammation, and leukotriene receptor antagonist. So people may be on some of these, they may be on all of these, but there are all different types of drugs to deal with like the immediate effects of an asthma attack, as well as long-term control of the inflammation that is taking place. Exercise testing, this is especially more so in a clinical situation. So they'll have them work out at a single stage on the treadmill for 6 to 8 minutes. And so we'll get them to a fairly high intensity, 65 to 75% of their VO2 max or heart rate reserve. And what they'll do is a pulmonary function test. So they'll do this spirometry testing, the forced vital capacity, and the FEV1 before and after exercise to look at any of the changes. And typically what a person needs to avoid before the testing is exercise for 12 hours because you don't want to be in that potential refractory period. And they also need to avoid caffeine because caffeine does somewhat mimic the rescue inhaler, similar structure of that, and it works on through epinephrine and through the same beta receptors. Let's look at FITT. So this is right out of the ACSM guidelines. So interestingly, they do recommend slightly lower frequency for people with asthma. So at least 2 to 3 days a week. So this is a change than what we would do for normal healthy adults. So trying to get people at sort of a lower intensity, high moderate 60% VO2 peak, so a little bit higher, or 80% of their walking speed. So at least 20 to 30 minutes. And we talked about the activities that tend to be not promote asthma quite as much. And then they mention here too, preferably in a non-chlorinated pool so that people don't get an asthma attack from chemicals. So the West Center is perfect for that. And then you can try to increase the intensity after about a month. So if people have done really well with that, try to increase the intensity. You can also try to increase the duration, and then ultimately you want to get the frequency to 5 days per week to get to people to a normal workout frequency. But this is obviously going to be very individualized based on where a person is going to be at. Resistance exercise doesn't really change. So people with asthma can do the same types of resistance training recommendations that anybody else has. And of course, if they're an older adult, you may want to work with neuromotor programs. Don't forget flexibility training. That would be the same as anybody else as well, depending on their age. So exercise programming, we talked briefly about that. Many athletes, high-level elite athletes have asthma and they can compete. They just need to have rescue inhalers, follow ACSM recommendations, which we just went through, breathing exercise, yoga, Pilates, meditation. And we mentioned about swimming. Scuba, that makes sense. You would not want someone to have an asthma attack while they're underwater. Things you may want to keep in mind is that if someone has a cold or other upper respiratory infection, colds may stick around a little longer for some folks. And then they have peak flow meters available in health clubs and schools. If someone feels that they may be having some chest tightness, and once again, you cannot stress it enough, the medication, the inhaler always needs to be with the participant. So safety first.